Hi, I'm Laura Barrett, and I'm a patient with familial partial lipodystrophy. We don't know my mutation yet, so I kind of fall into type 1. My story kind of starts when I was 27 years old. I was an internal medicine resident in the Navy, a second-year resident at the time. Seeing clinic, I started to have some pretty severe abdominal pain. By midday, I could no longer concentrate, went down to the ER eventually, and was diagnosed with pancreatitis. We eventually, a couple hours later, figured out that it was hypertriglyceride-induced pancreatitis. And my trigs were over 5,250, which is the max that our lab could check. So I was being taken care of by my colleagues as an internal medicine resident, because that's who takes care of pancreatitis, which was a little bit surreal. By the middle of the night, I was transferred to the intensive care unit. My calcium was going way low with the triglycerides so high. I needed more intensive monitoring. So we got the ball rolling to have apheresis. So that happened the next morning. I had complications including abdominal compartment syndrome. Was able to avoid having to be filleted for like pressure release, but just barely. And eventually I started to perfuse my kidneys again and kind of turned the corner. From that point on, I was a diabetic, and we didn't really know why. I'd had several different endocrinologists throughout this journey because of them moving, them deploying, me moving, etc. And so over time, I needed more and more insulin. I couldn't come off insulin since I had the pancreatitis, and we thought that was because of the pancreatitis, my pancreas just couldn't keep up. And so over time, I saw 7 different endocrinologists until I finally got my diagnosis. Through this, I was able to have kids. I have twin boys that are currently 5 years old. So I went through a pregnancy, managing both conditions with an insulin pump, and then a lot of fish oil when I was pregnant. But they turned out great. They were premature, but that's pretty common with twins. And they had a pretty uncomplicated NICU stay. And so when I was diagnosed, I'm a board certified internist, and I had no idea about lipodystrophy. And so the doctor kind of off the cuff is like, oh, maybe you have lipodystrophy. And I hopped onto the equivalent of a Dr. Google site. So it's called Up to Date, which is one of our main clinical references. And literally within minutes, I'm crying on the phone with the endocrinologist because I'm like, this is what I have. I knew pretty instantly once I'd read about it, that's what was going on. So I eventually got in contact with Dr. Brown, and I started on Mounjaro or tirzepatide in December of this year. So about 11 months ago. Prior to going on Mounjaro, I was on an insulin pump getting about 150 units a day. And I'm currently on no insulin. So I went inpatient at the NIH in April, and we stopped the pump at that time. I've additionally been able to stop fenofibrate without my triglycerides going back up. So they're currently in the normal range, keep my A1C at 6. So Mounjaro has literally been life-changing for me. And I look forward to seeing the changes that it helps in other patients with lipodystrophy going forward.